How can we integrate our climate and health solutions? And how can we capture health benefits that can be realized during climate adaptation? My name's Ellen Donovan. I'm a health scientist and I'm also leading our Healthy Cities initiative in the United States. When it comes to climate change, different cities have different priorities. Sea level rise matters a lot more in coastal cities, for example. And when you have sea level rise, you have a higher risk of floods. Some of the major health effects that can come from flood include the mental health issues related to displacement after the flood, or even the risk of spread of infectious disease. After a city gets a handle on its major climate risks, the next step is to undertake a health impact assessment. And that impact assessment can help a city understand or quantify the benefits that could be realized from undertaking that planning. And then that information can be used to compare and relate to costs. As an example, last year our health sciences team did a study in Gothenburg, Sweden, where we were looking at the health impact of converting a busy commercial area in Gothenburg, Sweden to a pedestrian-only zone. And so what we did, we had a whole bunch of air quality monitors up and down the street, and we combined that with air quality modeling to predict the reduction in air pollutants associated with this change. And then we used that information and combined it with published literature that relate health outcomes to air quality pollutants. And we looked at the impacts on the residents that lived in that area all of the time. We looked at the impact to the people that worked in the shops, and then we looked at impacts amongst those that just came and visited the area. Our analysis showed the biggest impact amongst long-term residents. So for example, related to the predicted nitrogen dioxide reduction, we would expect a concurrent 15% reduction in asthma rates amongst those long-term residents. We also saw a decrease in the number of expected cardiovascular events associated with the reduction in particulate matter. The ability to quantify these health impacts is really important. So certain health metrics can be fed directly into cost-benefit models. And so what this allows you to do is, you can calculate the positive health impact, like a reduction in disease, but you can go further. And then you can calculate, well, what are the costs that you just saved by reducing disease by that amount? So when you undertake any kind of project where you've created a certain health benefit, another important thing to consider is, how is that benefit continuing over time? So you've built a bike path, that's wonderful. Do you see a corresponding decrease in obesity rates, for example, in the population that's actually using that bike path? This is the final step to showing the value that you've created over time and helping to build a positive business case for the future. To sum up, the tools and the data available today to model climate risks and understand those health impacts and the costs and the benefits associated with undertaking certain actions during climate adaptation are improving all of the time. And so we want to help cities deploy these tools in the very best way to help them grow sustainably and in a way that is protective of not only the environment, but also of community health.